Hello, my name is Gary Bledsoe. Today we are going to talk about dynamic bracing for osteoarthritic knees. There are three sections to this video: the OA problem, current treatment options, and the dynamic bracing solution to the problem. Let's start by reviewing some information about osteoarthritis. Mechanical deterioration of the knee occurs due to malalignment. This results in a loss of cartilage more on one compartment than the other. This is typically caused by trauma or injury, high weight and activity level, or the amount of overuse. Research has linked the long-term instability of ligament injuries and meniscal injuries with early osteoarthritis. In terms of the occurrence of OA, 80% of the time it occurs in a varus knee. Only about 20% of cases occur in the lateral compartment. There are multiple levels of OA that are judged based upon the degree of injury or damage to the articular surface. Let's get more in-depth into how to treat this problem. There are several possible methods of caring for OA-deficient knees, starting on the conservative side with COX-2 inhibitors, then non-steroidal anti-inflammatory drugs, bracing, injections such as hyaluronic acid, then moving to more invasive options including arthroscopic debridement and lavage, grafting and transplants, high tibial osteotomy, total knee arthroplasty, and finally revision arthroplasty. Over the past few years, several of these methods of treatment have been called into question. This leaves only bracing at the conservative end of the spectrum. Additionally, the OA patient population has become increasingly younger. It is imperative to choose the right treatment at the right time. So what is OA bracing? What does it do? First, OA braces use corrective forces to align the knee joint, reducing the discomfort that can be caused by OA. This reduction can allow the patient to return to activities of daily living and can actually slow the progression of osteoarthritis, according to prior policy statements of the American Academy of Orthopedic Surgeons. The symptoms of OA occur while weight-bearing. Dynamic OA braces apply a corrective force only when the leg is in extension and the most relief is needed. No pressure is applied when the patient's leg is flexed, for example, while sitting or driving a car. You can see from this video, by using a dynamic brace, an increasing angle and force is applied in the last 30 degrees of extension when the force is needed. That force is removed as the knee moves into flexion, so there is no longer pressure on the joint. With dynamic bracing, the brace is more comfortable to wear for extended periods of time. Additionally, with a dynamic brace, we have the ability to compress more soft tissue, allowing for a much more effective device for heavier patients. A little bit about the research supporting dynamic bracing. The Rocky Mountain Musculoskeletal Laboratory in Denver, Colorado, performed and published several studies with the cumulative results of more than 100 patients. This technique involves the patient walking on a treadmill with a video fluoroscope, both with and without a brace. Video images are then downloaded to a computer for analysis. The computer analyzes all of the images and makes a determination of how much joint space opening is present in the knee before and after bracing. The accuracy of this particular procedure shows that the error is less than 0.4 of a millimeter. On the left, we see a leg with no brace, and we see that the knee is bone on the medial compartment. On the right, with the brace on the same knee at the same point, we notice that the knee is open. The results of this study demonstrated that 78% of patients showed joint separation while wearing the brace. More than 92% experienced pain relief. All of the patients that had no separation were more than 20% above ideal body weight. This same technique was used for a second study published in the Journal of Bone and Joint Surgery at the request of the American Academy of Orthopedic Surgeons. They used video fluoroscopy to evaluate 5 patients. Each patient wore each of the 5 braces and were measured at different points during the gait cycle. It was really the first independent, impartial analysis of competitive osteoarthritis braces. It was published in March of 2006. The thruster brace was number 1 in pain relief and joint separation. The detailed results showed that at heel strike, the thruster brace had the highest average condylar separation. By the time the knee moved into mid-stance, the thruster brace was the only brace that produced an average joint separation that was greater than the margin of error of the study. Just prior to toe-off, the average joint separation for the thruster brace was more than 3 times more than the next closest competitor. Let's quickly review dynamic OA bracing. First, the articular cartilage of one compartment in OA patients has degenerated, which can cause severe discomfort and what we call a bone-on-bone condition. Bracing provides a conservative treatment option to help reduce the symptoms of OA. The symptoms of OA are most present during the last 30 degrees of extension when the patient is weight-bearing. Dynamic OA braces apply a corrective force only in leg extension when relief is needed. No pressure is applied when the patient's leg is bent, for example, while sitting or driving a car. The brace is more comfortable to wear for extended periods of time. Thank you for taking the time to learn more about dynamic bracing for osteoarthritis. For additional information, visit www.breg.com/dynamic.